Hello, class. I'm Taylor Forsyth with Teammate, and we're presenting the con perspective of this debate we've titled, Six Sigma is not more effective in healthcare operations than TQM is. There's no debate that healthcare can benefit from quality improvement initiatives by adopting methodologies such as TQM and/or Six Sigma to improve operations. But to conclude which is more effective for healthcare operations requires a good baseline understanding of how healthcare providers are currently performing. Looking at recent overall hospital star ratings provided through Hospital Compare, which is a scale from 1 to 5 that consolidates key operational metrics and quality indicators about providers, 63% of hospitals are at or below 3 stars. This information is publicly available for healthcare consumers, and as we've learned in Chapter 2, customers that know certain companies produce better quality products than others, and they buy accordingly. This implied volume shift creates larger incentives for hospitals with low star ratings to improve their operational metrics and quality indicators. There's just one large problem. A large and growing percent of hospitals lack the operational stability and resources required to implement Six Sigma projects to move their organizations to the 5-star rating club. To support this claim, American Hospital Association found 30% of hospitals had negative margins by 2016. And the Congressional Budget Office estimates that by 2025, 40 to 50% of hospitals will be operating with negative margins. This tailwind of negative margins strongly suggests that providers should be focusing on basic operational blocking and tackling skills and rebuilding their businesses to regain operational stability. Negative margins also indicates hospitals are dealing with a high degree of variability in process outputs and should focus first on baseline process standardizations before engaging in improvement initiatives. Once this can be achieved, hospitals can make the choice as to what the most realistic methodology to attain quality improvement results are. Which sounds more attainable for a young aspiring athlete, playing for a college team or competing in the Olympics? This analogy isn't dissimilar when comparing TQM and Six Sigma. The scale of results and requirements to achieve them are different. Below is a high-level comparison between the two for your reference. To summarize the comparison, Six Sigma is a highly disciplined methodology that requires a much larger commitment of time, attention, and resources, whereas TQM is moderately easy to implement and focuses on creating synergies across functional areas that enable more effective collaboration to make quality improvements. Results can also be achieved much quicker than with Six Sigma projects. They carry much less implicit risk if they fail and can have a significant impact on morale and motivation for staff to continue making incremental quality improvements.
Article 2 talks about how total quality management is essential for the healthcare sector. It emphasizes Deming's principles, as in the book, and delves into the nature of the healthcare field, leading to customers usually not being given much of a choice when it comes to options and availability. The people waiting for 2 hours to see a surgeon would never have waited that long to do almost any other activity. There must be an integrated effort made for continuous quality improvement in our service hospitals for conforming to the needs of our customers as we move to healthcare being more consumerized. TQM is necessary because people do not have other options, and in order to fulfill our obligations to our customers, we must act in a way that drives down these dissatisfiers. Figure 1 is an example of a way to implement TQM in a hospital. The Department of Clinical Epidemiology at Latter-day Saints Hospital, Salt Lake City, used TQM to reduce the rate of post-operative wound infection from 1.8% to 0.4%. Another study has shown a 30% decrease in frequency of patient morbidity due to antibiotics by process improved computerized guidelines. These improvements are driven by TQM. This article primarily addresses the advantages and disadvantages of using Six Sigma in general. Several of the top disadvantages are very applicable to healthcare. For one, there is not the massive volume of data from many healthcare processes available that can reach Six Sigma levels. As noted in the book, Six Sigma requires precision to the millionth, and many of the areas that need the most improvement do not have enough occurrences to measure on this level. For example, a rural hospital in Alabama's biggest priorities are most likely in areas on trying to solve immediate problems of not being closed and having a positive operating margin instead of solving problems to the millionth degree in detail that Six Sigma requires. Another problem with Six Sigma is that many of the solutions deemed necessary are extremely expensive and not practical for many healthcare entities. Lastly, it is very difficult to define what exactly a defect is, as one process might have various stakeholders that could be the problem. It could be human error, a cultural problem, or a system problem. It is hard to decide on what measure should actually be attempted to be improved. As mentioned in the previous article, healthcare facilities throughout the country are struggling with having enough resources for drastic changes. This TQM journal explains how TQM has the potential to work in any healthcare facility committed to the delivery of quality care to the patient. It has a focus on results and managing budgets efficiently, which can be a key contributor to healthcare facilities that have a constraint on money. The article shows examples of TQM being applied and resulting in positive results. According to the article, Western literature is replete with clinical applications of TQM with appreciable result. A northern New England multi hospital project used quality improvement techniques to reduce mortality among patients undergoing cardiovascular surgery by 24% in 3 years. In the book, it states that TQM was and is a philosophy for managing an organization centered on quality and customer satisfaction as the strategy for achieving long term success. This backs the fact that although results may not be seen instantly, as in the example provided of 3 years, success will be reached for a sustainable future. This article covers how the relentless drive towards adopting Six Sigma to services has led both to a limited field of applications and to unrealistic expectations as to what Six Sigma is truly capable of achieving, particularly in knowledge-based environments. The broad variability in the healthcare field makes it harder for data to be as accurate as other industries that are heavily process based. In the healthcare field, several sub-processes exist within many established processes, making them difficult to measure and control. While Six Sigma is valuable in areas of healthcare with less variability, overall there are far too many variables in healthcare processes to accurately use Six Sigma as an improvement tool. Six Sigma works best in process based services such as banking and telecommunications that can be highly standardized instead of healthcare. TQM is a better tool for improvement in healthcare because it focuses on the satisfaction of the customer, not eliminating variability for processes.
As we've learned, there are many more hurdles organizations must overcome and master before implementing Six Sigma projects. A study was conducted by a hospital in Virginia that had been engaging in Six Sigma projects for multiple years, concluded a few of the top reasons projects failed were due to a lack of senior management support and project leaders lack necessary skills. TQM requires neither to be effective. To conclude, there are many variables healthcare organizations must consider before implementing quality improvement initiatives. And in the age of value-based purchasing, with inpatient site neutrality payments looming for hospitals, it makes intuitive sense that organizations need strong cultures of effective collaboration across clinical disciplines, business functions, and other providers to maintain operating stability and improve operations which will benefit the entire healthcare system. That being said, the TQM methodology is a more appropriate fit for most healthcare providers since it's more realistic, easier to implement, and attainable, and therefore more effective in healthcare operations.
Thank you for listening to our presentation. Here are our references. We look forward to a great debate.